Hi, my name is Louise Tulloh and I'm a sport and exercise physician. Thank you for taking the time to watch this little video that we've prepared for you on telehealth. Many people think that MSK disorders can't be treated by telehealth. However, our experience is otherwise, and certainly there is a lot of research worldwide to show that both the treatment and early diagnosis and management of MSK disorders is very well done through telehealth. So most of our information to diagnose a patient will come from the history, and then that history or provisional diagnosis is supported by physical examination. The physical examination, again, is mostly observation of how a person moves, observing their special tests, and then much less palpation, which the patient can do themselves, and then finally special tests of ligament instability, which do require hands-on to confirm, and that's what's missing from a telehealth consult. Our provisional diagnosis will often then be supported by more formal investigations such as x-rays or MRI scans, which of course can be organised remotely via telehealth services. So as specialists in MSK disorders, we're quite confident to get most of our diagnostic information via telehealth. And in fact, if most MSK disorders in the workplace are initially seen by general practitioners or generalists who are less confident and in diagnosing MSK disorders on clinical examination and rely more heavily on investigations. So in many ways, a more experienced specialist in MSK disorders can get better outcomes, even around diagnosis via telehealth, than a generalist in a face-to-face context. So we're going to show you a little demonstration of a back examination now. So this is our patient today, Dr. Alvina Ning. So she's not a real patient, but she's going to help us out today. So Alvina, we're just going to run through looking at your back today. So what I need you to do is that I can see that you're dressed so that I can see your back properly. So that's good. I'll need you to be able to step back from the camera so I can see your whole body, and I'm going to ask you to do some movements. I also need you to access a chair for some of the things that we're going to do. So is that all okay?
Yeah, that's fine.
Okay, so if anything is causing you any pain, just let me know. And when you do get pain, I want you to show me where it is. I'm certainly not going to ask you to do something that's very uncomfortable, okay?
Okay.
All right. So stand up for me. If we're going to start off with me looking at your back. So stand up so that we can see your back, and just move your laptop around or your phone or whatever you're on there. Perfect. All right. So Alvina, I just want to make sure your tights are level. So that's going to help me. If you want to lift up your top so we can see your tummy just a bit. Perfect. And then your tights are nice and level there. That just helps me to see how you're moving. So turn around. So I'm looking at your back. And just show me where your pain is.
Around this region.
Okay, all right then. So in this position, what I want you to do is just to stand on one leg. And now do a little quarter squat or a tiny little crouch or knee bend on that one leg and come back up. And do the same thing on the other leg. So hold the position and then do a little squat on it and come back up. And perfect. Now stand on both legs, and I want you to put your hands on your thighs, on the side of your thighs, and just slide your right hand down your thigh as far as it will go, and come back up, and the other side. So I'm looking at lateral flexion here, and we're also looking at the way the stability of the pelvis. Come back up, stability of the pelvis on single leg stance. So now I'll get you to, was all that okay?
Yeah, that was okay.
So get you to stand side on to me or to your camera now. Terrific. And in this position, I want you to just fall forward and touch your toes. Obviously, don't hit your head on the bed there. Yeah. As if you can touch your toes. Yep. Is that uncomfortable?
I'm just a bit nervous.
All right. Okay. Okay. So nice and flexible and come back up. Terrific. Now I'm going to ask you just to stand side on again so that I can see that your back. I'm going to ask you to bend backwards from your shoulders. So your shoulders bend backwards, your back is bending backwards like a banana. Great. Is that okay?
Yeah, a little bit uncomfortable on the right back.
All right.
Okay.
So now I'll get you to bend backwards again and lift your right heel up. And dip your left shoulder a little. Perfect. Does that aggravate you more?
A little bit, yeah.
Okay, and come back up. And we could do that the other side, but it was already sore on the right side anyway. So stand facing me now, Alvina. Perfect. Now I'm just going to check some of your the function of your nerves. I just want you to do a crouch down, just like a little bit of a squat halfway down, both legs, and come back up. Do you feel any weakness when you do that?
No.
No. So in this next couple of tests, just let me know if you feel any side to side weakness when you do them. So just walk around on your toes and on your heels. So I can't really see your feet, Alvina, but do they feel the same? That's okay. I think perfect. Just walk on your heels. Perfect. So I can see that there's no weakness, no gross weakness of Alvina's legs. So now pop the camera back onto your central.
Mm-hmm.
Terrific. Now we're going to actually use the chair. Sorry. So grab the chair and I want you to sit in the chair facing the camera. So it's facing front on. Perfect. No, that's fine. Okay, so now just put your hands on your shoulders like that and leaving your bottom where it is, just twist around to one side as far as you can go. So now we're testing rotation of the spine and the other way. And how does that feel when you do that?
A bit of discomfort on the right side.
Okay, and come facing forward. Now with the flat of your hands, I just want you to run your hands down the front of your thigh, down the front of the shin and the top of the feet. And I want you to tell me if any of the skin feels funny. So it could be burning, tingly, numb, anything weird from side to side.
They feel the same.
All right, now try that on the outside of your legs, outside of your thigh, calf. Does that feel the same?
Yeah, feels the same.
Okay, and just go on the back of your thighs where you can reach them and down the back of your calves.
They feel the same as well.
All right, so our last test today is actually often uncomfortable. So I'll get you to stand up. And what I'm going to ask you to do is turn around and put one heel up on that chair.
Okay.
So what might get you to do is stand side on, actually shuffle the chair around so that I can see you side on. Yeah, excellent. All right, now with a straight leg, put your heel up on the chair. Okay, so what I want you to do is I'm going to show you. I want you to put your heel up on the chair.
Yeah.
And I'm going to get you to curl down. All right, so I'll talk you through it. So you heel up on the chair. I want you to pull your toe back towards you. Yes. I want you to move your chest towards your knee. Excellent. Now you're obviously quite flexible. And now I want you to dip your chin toward your chest. Terrific. Exactly. Now everybody is uncomfortable here at some point, but just put your hand, the whole of your hand on where you feel your tension. Under there. Okay. And if you just lift your chin up again, does that change that feeling at all?
No.
All right. So let's try the other leg. If Alvina, this is a nerve tension test. So if someone has sciatica or any kind of radiation pain, this is an important test. And if Alvina wasn't able to get her heel up on the chair, we would use a stool or we would just use the ground here. So do the toe back, chest towards your knee, chin on your chest, and show me where the tension in this location is. Same place?
Yeah.
Lift your head up. Does it change at all?
No, it feels tight.
Okay, good. All right. Thanks, Alvina. So that's all. That's a really comprehensive back examination. The only thing that we did not do there is I did not do the sensation test myself. I did not put resistance of power in there and I didn't test reflexes. But other than that, it's a pretty comprehensive back examination. So thank you for watching this little demonstration, and maybe Cass will be kind enough to share the video and you can practice being the patient as I run through that back examination. So thank you. Bye. Thanks, Alvina.
No worries.